Morning or good afternoon. My name is Princess Lane Bonifacio. Thank you for joining today's presentation about developing and communicating the strategic action plan to improve health equity. For today's agenda, I will provide an overview of health equity, identify the associated issues, discuss the team's action plans, areas for consideration, communicate the topic to the whole organization, and conclude the presentation. Let's start with defining health equity. Health equity is the opportunity for each individual to attain the highest level of health in a just and fair system. To successfully implement health equity, an organization must apply these efforts: address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. The importance of health equity is to improve diversity in clinical trials and more representation of minorities, learn solutions to resolve health disparities that negatively affect minorities, and provide access to factual health information to the public. Let's identify the most common health issues that affect the majority. First is the social and community context. This is discrimination and racism towards people or groups of people. Access to healthcare. These are the difficulties in accessing or using healthcare due to their financial status or immobility. Environmental factors such as limited housing options and access to nutritious and affordable foods. Workplace conditions. This is the absence of health insurance or lack of worker safety measures. Access to quality education, low school funding due to marginalized bases, which results to low literacy and numerical levels. Finally is the financial status gaps. Lower incomes due to limited job options experience barriers to wealth accumulation and carry greater debt. Effective action plans are essential to solve health equity issues successfully, starting with collaboration and power sharing. This is to resolve the factors that affect health equity that are outside the hospital's usual tasks. Program investments, partnership with local programs that can assist low-income families to get health care services. Triage system. This is to identify the urgency of the patient's condition in a hospital, regardless of their race, age, or gender. Streamline the internal plans to provide effective patient care. And finally is the annual employee checkpoint. This is important to the staff to show that the company is not only focused on the welfare of the patients, but also to the employees. While working on the action plans, there are some areas that we need to consider on both financial and human resource aspects to meet the goals of the plan. For financial aspects, incentives may be limited, exploring for affordable supplies, outsource function, and internal cross-training. For human resource, long-term candidates are what we're looking for. We have to encourage diversity, go beyond credentials, and discuss expectations. The plans are to relay the message to the employees and patients that health equity is important, and it is for everybody. One-on-one coaching to set the foundation with the employees, checking the staff's knowledge to identify areas for improvement regarding health equity, inviting prominent speakers to an annual seminar to provide more insights about health equity, and let's not forget to acknowledge our partners and local organizations who support us to discuss future action plans. Moving on to the communication to the patients. Take patient surveys to learn insights about the hospital's performance on health equity. Hiring certified medical interpreters will demonstrate the hospital's effort to connect with patients in different languages in ASL. Finally is to make sure that the community should be educated regarding health equity by informing them about their rights. Some takeaways from this presentation are as follows. Identify the issue to set goals. Continuous collaboration with local communities and organizations. Initiatives coming from the organization can improve long-lasting results. Mutual commitment across the board will share expected benefits within the community. Recognizing and respecting the differences of other people will make a big difference on how people perceive the facility and the staff. And finally, proper communication within the organization and the society to deliver the message of the project. Thank you all for taking the time to listen and learn. We are now ready to implement the improved version of health equity.